I would request the chair of the forum, Global Forum, Ms. Masten, to share with you I think the purpose, the objectives of the forum and the activities of the forum and the experiences from the previous workshops.
Welcome, everyone. It's my great honor as the co-chair of this forum to tell you a little bit about the background. My co-chair is Zulfi Bhutta, who was unable to join us in person today, but will be participating through the wonders of technology throughout this event. The forum was launched in January of 2014 by the Institute of Medicine and the National Research Council of the U.S. National Academies. It is jointly sponsored by the Institute of Medicine Board on Children, Youth, and Families, and also the Board on Global Health. A year-long planning process went into establishing the forum with planning grants from two foundations, Bernard Van Leer and the Doris Duke Charitable Foundation, and a great deal of contribution from many voices, organizations, and people who participated throughout this year-long planning process. I wanted to say a little bit about the context in which this forum emerged, because I think it's very important for our conversation. There has been a growing sense throughout the world over the past few years that we have made real progress in promoting the survival of children around the world. Over the past few decades, there's progress, there's traction. But now there's a strong consensus that we need to raise the bar in what we're doing, that we want more for children in child development than merely surviving. We want them to thrive and develop into healthy, productive people for all of our societies. At the same time, there's been exciting new evidence emerging. The science of early childhood has grown by leaps and bounds in recent years, and we now understand in much more depth the links between child development and early child experiences and lifelong development of human capital as well as health. We also know that the well-being of children is linked in a profound and lasting way with the productivity and well-being of their future societies. So there's a convergence among many stakeholders in early child development and investing in early child development, and there's an interest in addressing ongoing threats to children and putting together the best evidence we have to make the most strategic investments on behalf of children. The mission of the forum is multifaceted, and here are three key aspects of the mission. We want to identify the best evidence on how to make these strategic investments in young children and also their caregivers. We want to integrate the knowledge across sciences and contexts and generations, as well as to integrate what we know from different sectors that have been the focus of science and practice in child development: health, nutrition, education, and social welfare. We want to put knowledge together and break down those silos. And the reason for that is to try to inform and shape the policy making as well as the practice across sectors, across scales, across the globe. We envision a global evidence-based network of activity for promoting healthy development in children. We also have multiple methods and strategies, and these continue to expand and grow. This workshop is one of those activities, and we hope that you'll all be participating now and going forward in the future in a dialogue among stakeholders. It's a multimedia dialogue, so this workshop we're involved in is being broadcast on a webcast, and we're hoping that many of you will be tweeting or communicating through social media what's happening here. We've planned 3 workshops a year, And you have received a copy, which is shown here, of the report from the first workshop that we have held. So we're going to hold these workshops around the globe, and we'll also be producing reports from those workshops, as well as many other forms of communication to share what we're learning from our dialogue, what we're learning from our workshops, and other activities of the forum. So we have news feeds, we have video. We hope you'll go to the website and take a look at all the products available. And we also have began to produce infographics. You have one early form of an example that was given to you in today's session. And we like to think of ourselves as a unique learning community. We are evidence-driven, international. We are very collaborative across many sectors and countries and perspectives, and we hope to be visionary with the help of everybody here and everybody who's participating across the world. I want to close by having the forum members who are actually present with us today to very briefly introduce themselves. We're going to begin with you, Eduardo, down there, and somebody's going to bring you a mic. And just to give everybody who's watching here today a little sample of the kind of diversity of perspectives and locations and sectors that are represented by the forum membership. Go ahead.
Hello, good morning. My name is Eduardo Quiroz. I'm from Brazil. I'm the director of a family foundation called Maria Cecilia Souto Vidigal Foundation, and our focus is generating and disseminating knowledge about the importance of investing in young children. And it's a great honor to be with this forum, this group, and I believe we have a very important challenge, and we will succeed on this challenge. Thanks. Thanks, India. You're a nice country.
Quentin.
Good morning. My name is Quentin Wadon. I work at the World Bank, and I manage part of the work that we are doing on early childhood development. And again, it's a pleasure to be here. I love India. My wife is Indian, so I love to come here.
Good morning. My name is Saramina Abubakar. I'm a research psychologist. I'm from the Kenya Medical Research Institute. It's a pleasure to be here. Thank you.
Hi, good morning, everybody. I'm Jody Hyman. I'm Dean of the UCLA School of Public Health, and I also direct something called the World Policy Analysis Center, where we look at what 193 countries are doing in social policy and social equity, and I greatly look forward to learning from all of you who've come here, as well as from the people who came to speak.
My name's Stephen Lai. I'm Executive Director of the Fraser Mustard Institute for Human Development at the University of Toronto. We're interested in how early environments influence a child's lifelong health, learning and social functioning, and I'm here to learn from all of you and about your expertise in this area.
Hello, I'm Amalia Waxman, and I'm Head of Public Affairs and Communications at Nestlé Nutrition.
Good morning, I'm Vesna Kutlasik. I'm with the U.S. National Institutes of Health, and more specifically, the institute responsible for maternal and child health research. And we have many projects in India, so I look forward to sharing information with you and learning more about what the needs are. Thank you, and thank you for your hospitality.
Good morning, my name is Carly Silver. I lead the Targeted Challenges at Grand Challenges Canada. Grand Challenges Canada is funded by the Government of Canada, and we support innovation for health outcomes and development outcomes, and early child development under our Saving Brains program is one of our focuses.
Good morning, namaste. My name is Simon Sommer. I'm from the Jacobs Foundation in Zurich, Switzerland, and we are one of the largest European foundations focusing on children and youth only in research, intervention and communication. Thank you. Who is next? Okay.
Good morning. My name is Larry Aber. I'm a professor of developmental psychology and public policy at New York University. And with Hiro Yoshikawa, my colleague, we co-direct a center that's designed to help understand how to design, evaluate, and implement at scale creative interventions for children and youth in low-income and conflict-affected countries. And I'm thrilled to be here.
Good morning. My name is Lorraine Scher. I'm a professor of clinical psychology at University College London. I do a range of research. Much of it is to do with HIV infection and AIDS and other family conditions like parental mental health, which disrupt and derail and stand in the way of the paths of child development, and try and look at research that can restore and revitalize healthy pathways to ensure that children have the best opportunity possible.
Hi, good morning. My name is Albert Lee. I'm currently working at the Chinese University of Hong Kong. I'm a professor of public health and primary care, and I direct a center for health promotion with strong interest in school health, linking different sectors together, how to promote healthy childhood development. So I'm very delighted to be a member of the forum. And when I was young, many decades ago, between my trip from Hong Kong to London, I always passed India but never have a chance to come out. So I'm very delighted to be here. It made me feel wonderful memory of when I was young. Anyway, thank you. Nice to be here. Thank you.
I'm Constanza Alarcón. I don't speak English, but I work with government of Colombia. I coordinated the police early childhood in my country. I am very interested in learning about experience from around the world. Thank you very much.
Good morning. I'm Joan Lombardi. I'm just delighted to be here and to see so many friends and to meet new people. I'm with the Bernard van Leer Foundation, which is in the Netherlands. I do their global strategies work from my home in Washington, D.C. Thank you.
Hi, I'm Hiro Yoshikawa. I'm a professor of globalization and education at New York University, and it's wonderful to be back in this very same room a few years after the South Asia Regional Conference on ECD. And in addition to the center that Larry Aber and I co-direct at NYU, I co-chair the work group on early childhood development and education of the UN Sustainable Development Solutions Network. Thanks.
Good morning, everyone. I'm Caroline Arnold. I'm the Director of Education at the Aga Khan Foundation. The foundation is one part of the Aga Khan Development Network, which includes universities, hospitals, health centers, schools, and also a trust for culture, microfinance banks, and for-profit companies. And one of the key emphases of His Highness the Aga Khan is early childhood development. Whatever part of the network we work in, that is really a top priority. Attention to young children and their healthy overall development. So we work in South and Central Asia, in East and West Africa and the Middle East and parts of Europe, and I'm really looking forward to talking with you all later today. Thank you.
Thank you. There are three more of us up here on the podium, Pia Brito and Benita, who you've already heard from, and myself, and you'll be hearing more from us as we go along. But I'm thrilled to be here. I hope you can see this is just half of the membership of the forum, and they represent an extraordinary range of expertise and interests, but we all share that common vision that we're working on. What can we do to promote healthy and positive child development around the globe? So I invite you to join the conversation over the next couple of days, and we're thrilled that you're all participating. That applies to all of you online as well as all of you who are sitting in the room. Thank you.